So just to kick off, the headlines recently have been that Quadria closed a $1.07 billion fund. That's huge. 10% of the fund from India. You already manage more than $4 billion in assets across 27 portfolio companies, from what I gather, across Southeast Asia as well as South Asia. And you've been called the largest dedicated healthcare private equity player in this region. Can I kick off by asking you a little bit about what was the vision when you set up, how you look at things now, especially where you've reached, and of course, congrats on this fund. It's massive.
Thank you so much. And I guess there's a huge amount of hard work, but also an element of luck that has got us where we have. We began our journey in 2012. I and my partner Abrar. Abrar comes from a healthcare investment banking background. As you know, I come and as a physician, as an operator, and somebody who's run healthcare companies before. So it seemed to be a great marriage of convenience, bringing different skill sets together. I think today we are very proud that we've been able to establish South and Southeast Asia's largest dedicated private equity, and the numbers that you had quoted are correct. Um, but I think what's very important is to just talk about the thesis. This hasn't happened by default. It's actually happened a lot of it by design, where we believe that Asia would become the global center of gravity for healthcare. And this is driven by population demographic trends, it's driven by rising incomes. And there is a massive chronic underinvestment by any government in this region. So we barely spend 2% of our GDP on healthcare, which should be in the high single digits. Compared to the US, it's almost 15, 16%. What that means is that 60% of the world's population is going to be living in Asia, and we will also create 60% of the world's patients. And we don't have the infrastructure to cope with it. And kind of COVID exposed all of us that we are never going to be able to do enough. While the numbers seem daunting, about $1 billion here and $4 billion assets under management, in the grand scheme of things, there is still a lot to be done. So, yes, we worked hard. We have almost 27 investments in the region. But to our mind, we need to work closely with public infrastructure to actually make a dent in the problems that we have.
That's interesting. And I'll ask you a little bit more about that and your portfolio companies. Just to cite, I think it was BCG that said the healthcare market in APAC is expected to reach $5 trillion by 2030. So that scale you're talking about, it is massive, maybe more than we've noticed.
Yeah, so just to give you a data point, I mean, in 2025, the US and Europe combined was spending 4.5 trillion US dollars in healthcare. By 2030, Asia will be spending more than that. So just talking about healthcare, it's growing at almost 10 to 15% CAGR year on year. As I mentioned, there's not a single country which has put enough healthcare dollars to work. It's quite clear that healthcare will continue to be an investment bright spot for the multiple years. And I just want to expand on the theme. There is this massive inflection that's taking place, and I'm speaking now as a doctor, of what I used to treat as acute care infections. And now the epidemic in chronic care. What does that mean? Obesity, diabetes, hypertension, kidney, oncology, environmentally related pollution disease. What that means for us in the infrastructure is that if I get diagnosed to be a diabetic today, I am going to be a diabetic for the rest of my life. So now you need to create an entire ecosystem around me of doctors, tests, insulin, testing for the next 40, 50 years. There is never going to be enough money for it. So as we had embarked on our journey, we spoke about the fact that we want to do four fundamental things. We want to improve accessibility in our part of the world. Healthcare should be delivered where you live. Healthcare should be delivered at point of care. It should not need people to travel 500 and 1,000 kilometers to come access healthcare. The second is that we wanted to make people aware that there is preventive healthcare that is on the anvil. Again, as COVID showed us, we will never be able to treat enough patients, which means that you need to now prevent disease. The third component of our strategy was how to make it affordable. 70% of my patients are still paying for healthcare out of pocket. Healthcare, in fact, has become the single largest cause of people going into bankruptcy. It's no longer agriculture. There's enough support systems there. It is healthcare. And finally, just because my patients are paying lower than the best doesn't mean that they should get shitty care, and quality needs to be foremost.